Sometimes we'll do, it depends on the doctor. We don't do as many as we possibly can.
Okay.
This will be much
Okay,
nicer.
I love that. So do you guys generally only swab the ear that is bad?
No, you should do both.
Okay,
Yeah.
I was just asking because most of these have one Q-tip.
I think we did one for each ear.
Oh, perfect. Okay, yes, you're awesome. I was gonna say there's not like a discount for only doing one ear. These kits, so this machine is pay per run like your SediVue. So you guys only get charged if you run it and get results. So if you put, like, say you do one day, just do like the right ear because the left looks totally fine. The vet lab station will alert you at the end and say, hey, there was only sample in the left side or whatever. So that's something too that it kind of does. It will call you out. I just want you to know there's not like a discount for only doing one ear. And IDEXX always recommends both because you guys might find things that you weren't expecting by swabbing that ear. So when we talk about ear cytology, we have these ear cytology prep kits. They look just like the blood morphology. I'll pass it around, except there's a right and a left side. Something cool about IDEXX, those little kits, so you guys are using the gold standard Q-tips, like the wooden shaft. So in the little diluent squeezy tube that we had for the blood morphology, there's like fins on the inside that we're going to take this Q-tip and we're essentially going to clean it off in the diluent tube to get all the sample into the diluent. If there are like chunks, like if you have like an ear mite cat or something, really try to break those up because it's going to clog up the cartridge when you're trying to squeeze it out, if it even lets you squeeze it out of the diluent. Something that we say, kind of rule of thumb, you need less sample for the invue than you're used to for a normal ear cytology. With normal ear cytologies, I don't think IDEXX realized how much variability there is in the field. Like, everyone does it different, whether it be like the part of the ear that you collect from, et cetera, et cetera. We need, just picture, like if you were to collect, you know, enough to roll out so the light could really shine through on your microscope. We're giving the invue, like the SediVue takes 70 images and shows you the first 12. The invue is taking a ton of images of your sample, and it doesn't have a way to do like a dilution like the SediVue would. So if you guys have that disgusting like swamp ear, we actually say you can put the Q-tip in and do like half of a twist. That's all that we need, because we really want to make sure it can see through all the layers and tell you what's in that ear. One other thing, so like with normal ear cytologies, I find the hardest adopters out of the 20 that I have are the ones that are used to doing it in-house, because just like you roll it out right, and then a lot of times, maybe you guys do read the entire slide, but you kind of zone in on that big clump of stuff, and you're like, okay, here's everything I need. The invue it's more of like a homogeneous sample, because we're cleaning that Q-tip into the diluent, right? We're giving the invue everything that we saw. If you guys ever do like a comparison, we recommend using the same Q-tip. But keep in mind that you've rolled out half of what the invue would have gotten. So like that's just kind of a challenge that we're still working through with ear cytology. Some people that have been doing it the same way for 20 years are like, this is totally wrong. So use it, see how you feel, keep us in the loop. But most clinics are absolutely loving it. There's just a few that they're like, we've done it this way forever and that's how we like it. And we're not here to like force you to use the machine. It's a really cool tool, but it's going to be really different when you guys actually see the images too. Like we're going to see them really big on this screen, but they're not like what you're used to looking at under a microscope.
If you have like ear mites or things like that, is that going to identify, like just do those
yes,
too? Yeah.
So it identifies ear mites if they're alive. If they're dead, there's no movement. It's looking for the vibration. So the way it was described to me in Maine, because when this first launched, mites were not part of ear cytology because we were trying to get like the same good image over and over to train the algorithm, and they would like move under the light, and so we get like a leg or an antenna. But it is really good. They've been sending a lot of enhancement to this machine, and it's catching it now, so that is exciting. But yeah, so that's kind of the ear mite thing. Maybe there's going to be ear mites on this, but they'll probably be dead now if it's old. But still really fun. Let me see, just so I don't miss anything. Here's this, of course. This is some light reading for you guys to look through, just of the different images. So the first image, if there's no bacteria, it's going to look black. And the first time I ever installed one and trained on it, I was like, this machine's broken. There's just no bacteria, so it was totally black. The composite shows yeast and white blood cells, so there's like a Google Maps button, just like the SediVue. You guys can tap that and it'll flag it out for you. There's a different like bright field way of viewing them as well, and the ear mites will be last. It's actually a GIF, so they're moving on the vet lab station. So yeah, that's really exciting. This is some info about the challenges of manuals versus invue, just for the doctors to have if you guys are interested. But here, I'll just grab a new kit and we're gonna prep one. I'm actually gonna let you guys do this because it's super like easy and it's kind of fun. So I like to do hands-on training. Do you want to request one from there?
I'm gonna join my
Let's do miso or bear. I don't know Alex's one too. I can't read it all, I'm sorry.
That's all right. What's, you have any misos or just hand me one more second because I'm asking. Just for a second.
Oopsies.
Is it?
Here. You can prep the other one too. So yeah, go ahead and yeah, so just order diagnostics in-house and then type in ear cytology invue and it should come up.
For sure not. But it's, I'm coughing here. Where it's just wrong. You coughed me earlier.
Did everyone see it?
It didn't come over.
Oh, it didn't?
No.
It, oh
There it
yeah,
is.
it did.
It
So
did.
it,
Okay,
it
good.
took
Okay.
like 5
I was
seconds.
like,
Yeah.
I know.
This is the worst training ever. Just
Listen,
kidding.
I'm like the clicker of like, where's that?
I love it. I love it.
That you
Okay.
covered it.
So go ahead and grab like whatever. Are we doing miso
Yes.
then?
Yes.
So left and right. So one of you guys, these do not matter until you put sample in them. Same with the caps. It's just like a blank slate. So go ahead and get out your Q-tip. Take that off. I'm sorry.
Throw
I
it
just
at
reached
Mary
in
Jane.
front of you.
It's okay, I forgive you. So take this off.
Yep, you're gonna take off
Turn
the
this way around
foil.
so we can see it.
And the ridges are pretty obvious. You can see them. You're going to go like in between each one and kind of just twirl it around. And there's really no
so all
wrong
5
way
of
of doing
them?
it.
Okay.
Yeah, so just kind of go around and really like clean that Q-tip. You want it to look almost clean and dry and like white again. And granted, some ears that are really filthy like might not be totally white by the time you take it out. But once we really feel like we have that debris and see how the water's getting kind of dingy or the diluent, we're gonna really like squeeze the top and kind of pull the Q-tip out to get everything out of it. So like wringing out a towel almost. How do you guys generally, I'm going to talk while you guys are doing that. How do you generally, like, who's collecting the ear swabs? Is it the doctor or, like, the technician or
depends.
assistant? Okay.
Yeah.
These are a tool if you'd like to utilize them. You guys are going to see when we go to initiate this, it's going to ask us a few, like, clinical questions about the pet because it's going to pair the findings with these clinical signs to give you like a diagnostic consideration at the end. Do you guys still have those Q-tips or did you pitch them? Did you kind of wring them out at the top really well? Okay.
I did not, no.
Yeah, so we're gonna do that really well and don't be afraid to like overdo it, honestly. Like we wanna get everything out of that Q-tip to give to the
Like
machine.
pushed against, right?
Yeah, well let me see, I'll show you. So we kind of like squeeze the top and
Oh,
like,
I see what you're saying.
yeah, so we're gonna like, we want it to be like dry.
Mm-hmm.
So see, it's like kind of mangled, like, and I'm gonna do just a little more because see that chunk was still kind of there. But yeah, you're gonna like, I like to twist it as I squeeze to like wring it out like a towel. Like we want it to be clean and dry. Yeah. Yeah, that looks good. Yeah. Don't be afraid to be like too aggressive, honestly. So go ahead, you guys can each take a cap now. And you're gonna, there's another foil. If you need to set the diluent tube in the sample area, you can. and then make sure there's a pellet in there. So I have seen occasionally a pellet is missing, and it will give you goofy results because there's something in there called focus beads. Since this is a liquid, think about the microscope looking at an ear sample. Like there's gonna be all different layers of things. So the focus beads help the invue look at what's actually in there. So if there's no pellet, you're not gonna have the beads and you're not gonna get the right answer. I've seen it only at one clinic, but I tell people now. So go ahead and like kind of dump that over. And that, yep. And now you're gonna squeeze the top down till you feel the click. Yeah, like all the way. There you go. And now do like your 10 inversions. Good job.
How long does the ear swab take to run?
It takes 10 minutes.
Okay, so
yeah.
about the same.
Yeah, and we're working to get it lower. I was like, can we get it to like 3 minutes? Well, because some clinics, if you guys have 2 doctors on, they both need it. How long are your appointment times?
Depends on the doctor, but usually like
Yeah.
10 to...
Yeah. So, yeah. So this is something you guys can get the samples and prep it like while they're in there maybe. Okay, so now you're going to twist off the top. It reminds me of that like candy, that like wax candy. Do you guys know what I'm talking about? It used to be at Supreme Nut and Candy.
Yeah.
Now there's only a few of those. So you're going to go, each chamber has like a right side,
I
right?
can't get
So
it.
you're going to kind of squeeze everything out into whichever side you have.
Just everything that's in here?
Yep.
Pull it?
Yeah, pull.
And see how it's kind of like wicking.
I mean, what is she? Wait.
Yeah, that's
I
good.
think you pull it.
Oh, let's break this off.
Oh yeah, you
Okay,
just
so-
really twist, and then
Ah,
it kind of
so I can't-
cracks. Okay. It doesn't want to come off.
Oh,
Doesn't like
There we go,
to.
okay.
There you go. Perfect. So now you're just gonna squeeze it into that little, yeah. This obviously spits it out, guys, so you can just grab and discard the cartridges.
Just on this.
Yeah, just squeeze everything out. We want to give it everything. And this should almost fill up that whole chamber. So that kind of is something too, like to check your sample prep. Like, did I wring it all out? Because we want that to be almost full. And it's going to take a few times, like, to really get it down. But this is fine for training.
Is it like 6 drops in there too? Or
So it's just the entire contents. Yeah. But the invue is looking at this area right here. This is overflow. But most of the time it does fill up the entire chamber. So that's just kind of a way to be like, maybe next time I'll wring it out really a little bit harder. So we're gonna come to the vet lab station and you're gonna tap Meso Madden, and then we're gonna tap invue and sample type ear cytology. So this is what I was talking about. Does anyone know about Meso, like his situation? We can just make it up. It's just for fun.
Is it a cat?
Yeah. So we can say this is first time acute. So you just tap through. And then clinical signs. So this is basically that form that you have, and you can write on Expo and like wipe it off if you guys like those. So this is kind of like, is he itchy left or right? So we can say like both, just for fun. Erythema. Was it? Okay. Redness, ulcers, swelling, pain, odor, discharge, any of that?
I would say discharge, and I think there was odor.
Okay, perfect. When you tap discharge, it opens up a whole entire other platform. So does everyone know what purulent is? It's pus, right? So like dead white blood cells. So when we tap that, it heightens the invue's ability to like really look at the white blood cells. Yeah, so that's important. So make sure you tap that if it is a pussy ear. Waxy, watery, bloody, coffee ground, slimy, mucus, unknown is an option too if you just don't know. But the more information we give this, the more it has to like give you the diagnostic consideration at the end.
That's really nice.
Yeah, so we'll just say maybe were they waxy a little bit? Okay. And then that's fine. So we'll just hit save and then go ahead and tap a run. And this is about the time we're going to take that cartridge. This is going to open up and we can, insert it. Oh, sorry, it'll open up in a second. Yeah, and then it lights up. It's always a few seconds behind us, right? Just like that Connect Plus. Yep, and then just press start. So that's it. That's kind of the ear cytology. So my best advice is just take your time cleaning the Q-tip and the diluent. But other than that, you guys are gonna do fine. This was Testerson's invue Yep, so it did give us more this time. So it looked at his CBC, and then he did asterisk some of the white blood cells. Again, these are old samples, so those cells might have been a little degraded. But this is more of a representation of the images you're gonna get, like kind of zoomed in. Some people have asked, like, is it gonna call out heartworm yet? It'll be in the images, but it doesn't call it out. Our professional services veterinarian did see it in a clinic. But you guys know blood morphology, like that's probably a platelet and then just white blood or red blood cells. So like if you have clients that like this stuff and if you have time to show them, some people these days like appreciate that. But these are the real pet cells that I always just love to say. It's not AI like red blood cells. It's actually Testersons or whatever the pet's name was. It does kind of note A and B. Obviously, this was imported from the pro site, which is why we ran it first. So, does that all make sense?
Yes.
Okay, cool. So yeah, now we just have our timer, and we just wait.
Okay.
So, questions? I'm gonna hang if you guys want to run a few more of the ears before I leave. We can even do more of the blood morphology too.
I can send them over too while we're here, so we can
Yeah.
give them to you at some point now. Or somebody else can send them. Why don't you try it? Yeah, you guys try. That way you guys can know how to do it. 'Cause I've heard
Do you
Peg
have
go run this.
questions
You guys
from
have-
seeing it?
I'll give you-
Ears.